Hello, I'm Claire Ely and I'm Head of Service Improvement here at the Freud National Centre for Children and Families. I'm also a family therapist and I used to run a mental health service for children and young people. There are two kinds of NHS service for children and young people. One would be a community service, which is called CAMS or CYP Mental Health Services. CAMS stands for Child and Adolescent Mental Health Service, and these are based within your community, and they work with a range of difficulties, right up to young people who are feeling very unwell and might need to go into hospital as an inpatient. The second types of service are called inpatient units or Tier 4 units, and these are for young people with more serious difficulties than can be worked with in the community. What makes a good service might be different to different people. Often young people that I've worked with have heard good things about a service from their friends, their peers, or a professional like a teacher or a GP, and they've come on a recommendation of somebody that they know. I would also suggest that you look at the materials that a service produces. So sometimes looking at a service's website will tell you a lot about a service and whether it's a good fit for you. What I would suggest would be important would be words like collaborative. Are they working with young people? Where are the voices of young people within a service? What choices would you have on the type of interventions that you access? And how could you let them know if something wasn't working for you? I'd also want to know how helpful a service had been. These are some of the questions that you might want to ask at an initial meeting at the service or when you first refer yourself or another person refers you. Accessing a service can happen in different ways, and it's called making a referral. You or your parent or your guardian could make a referral for you if a service has a self-referral process. That means that you could actually telephone the service, email the service, or drop into the service to discuss your difficulties and see if they would be helpful to you. If a service doesn't accept self-referral, and lots of services don't, you might have to go via a professional, and a professional might be a social worker, a teacher, a GP, and it would mean having a conversation with them, telling them that you had some difficulties, and then asking them to make a referral on your behalf. I really appreciate that when you're waiting to access a service, it can be really stressful and really hard to know what to do in the meantime. What I would recommend is actually calling the service. Once a referral has been made, if you've made the referral yourself, you can ask the service how long the wait time is, because there might be a different wait time for your initial meeting or your assessment with the service to actually starting an intervention. They could be different things. So I'd always suggest, whether you've made the referral, your parent, your guardian, or another professional, to follow up with the service and to ask them how long their wait time is, because it can vary across different services. Who you work with within a service will be dependent on the type of difficulty that you're experiencing. For example, if you're experiencing a lot of anxiety and worry, it might be that somebody who's trained in CBT, cognitive behavioural therapy, would be more helpful to you than somebody who's trained in a different intervention. What we would hope is that services look at an evidence base to inform what offers they make to young people. The evidence base means that we look at what's most helpful for a particular difficulty, and we try to have that discussion with the young person to explain to them what would be more helpful in terms of their symptoms and difficulties that they're experiencing. What's important about who you work with within a service is that you feel that you have some choice. Whether that's about age, gender, the locality of the place where you're going to meet the practitioner, all of those things are important. as is the time of the session, because there might be particular things in your life, your schooling, that you don't want to miss on a regular basis. So I'd encourage you to have a conversation with the service at the point of referral to let them know what's important to you about the person that you work with. We think that your voice is really important in the treatment or the intervention that you receive. You're working collaboratively with the practitioner to help them and you find a way through the difficulties that you're currently experiencing. It's really important that you feel like you have a good relationship with the person that you're working with, because if you don't, it's highly unlikely that the treatment, the intervention is going to be helpful to you. If at any time you feel that you're unhappy with the intervention that you're receiving, we would really suggest that you try to have this conversation with your practitioner. I appreciate that that can be really hard sometimes, and there should be other means within a service, either via making complaint or speaking to a manager, to think about how else you might be able to improve the relationship with your current practitioner or change to another practitioner.